MR spectroscopy, you really do have to use the same head position in people, so you measure the same elements in everybody. The size of the voxel, or the size of the kind of the sensing element you use, needs to be smaller than the area you're looking at. There was a study that came out of Harvard, just across the Charles River, I guess, and they were looking at an MR study, spectroscopy at people with lead poisoning. And they used a 2 centimeter voxel to look at the hippocampus, which is 1.2 centimeters. So I called a guy up and I said, why did you use such a big voxel? You're guaranteed to have 0.8 centimeters of non-hippocampal tissue. And no kidding, the guy is a professor, big man. He says, well, it doesn't make any difference. The tissue's the same. Okay. N-acetyl aspartate tells you about white matter. Choline tells you about acetylcholine, the main neurotransmitter in the brain. Myoinositol tells you about glial cell elements. Lactate tells you about capillary hypoperfusion. Glutamate to glutamine is suppressed in most of your patients. You'll see the manic people, the ADD people, you'll see that elevated GG ratio. It is fascinating to me that psychiatric illness symptoms are reproduced very often by inflammatory changes. And then it bothers me when someone makes a psychiatric diagnosis in the face of inflammatory conditions. And I gave you a few examples yesterday. But when you see when someone diagnosed as somatoform illness, and they've got all these different illnesses and symptoms, and then you make them go away and you ask the psychiatrist, you know, what does he think about that? You're probably not going to get a satisfactory answer, because you're actually challenging his credibility. This is what a MR spectroscopy curve looks like. Here's N-acetyl aspartate peak. Here is some of the glutamine and glutamate spikes stuck in here. It's great fun to be able to look to see chemical signatures of inflammatory disorders. It's black and white. Hippocampus, you know, is a memory area at the base of the brain. The nice thing is that you can correlate ERMI scores in people with MSH less than 35 with the abnormalities in lactate and glutamine ratios. And it shouldn't be a real big surprise. You know, if you're going to get sick from a building with an ERMI more than 2, they should have abnormalities of capillary hypoperfusion. And if they do, then you will see these abnormalities showing up. But with these really badly water-damaged buildings, and some of these ERMIs can go way over 14, but you're almost guaranteed to have 7 of 8 abnormalities looking at lactate and the glutamate ratios in 4 areas of the brain.